Well, Harry, thank you very much for Surescripts' leadership and hospitality today. I know I speak for my colleague, Governor Bredesen, in thanking you for initiating this competition, for highlighting the importance of e-prescribing, and it's a real honor and privilege to be with all of you this afternoon. Phil, you're the 48th governor of Tennessee. I'm number 82, so obviously you have more staying power than Vermonters on average. But it's been a real thrill to work with Phil over the last couple of years since NGA started the State Alliance for E-Health. We've been at it for 2 or 3 years now and continue to focus on all aspects of electronic records, health IT, the kinds of innovation that I think are going to really make a difference to the delivery of health care and containing its cost throughout our country. I noticed in our local paper just the other day a headline that says, "Hospital Enters Paperless Era." It refers to the largest hospital in Vermont, the Medical Center in Burlington, and that's happening all across America. And I believe that's going to make a tremendous difference in the outcome for the American people and the cost of delivering care as well. Well, when we started our e-health alliance responsibilities a couple of years ago, we began to focus on a couple of different areas, but we realized that e-prescribing was one that ought to be at or near the top of the list. It's kind of a no-brainer when you think about it, to reduce the likelihood of error, to make it more cost-effective, to get the information delivered as quickly as possible to pharmacies. So we made that an early initiative of the Alliance to encourage e-prescribing to an even greater degree around the country. I think it's a way that we can build momentum for other types of health reform, frankly, by showing the provider community and public policymakers that this really is something that can make a difference. And so it's a pretty simple concept, but it's really going to be important to the delivery and cost of care. We need to do everything we can to encourage more providers, more pharmacies to get into e-prescribing. We have some encouragement from the American Recovery and Reinvestment Act, the so-called stimulus package that's been approved by the Congress. And with or without that, we need to make it a top priority for health care delivery in our states. So I really appreciate Surescripts being in the forefront and providing this opportunity to shine a light on this important policy decision. The DEA, I think, needs to be engaged too. We've talked about that and hope that that can be a part of our reform efforts in the not-too-distant future as well. States are going about it in different ways. We have a public-private collaborative in Vermont called VITAL, an acronym for Vermont Information Technology Leaders, and that has brought the provider community and private firms together to focus on e-prescribing and health IT generally. Other states have put councils together, I know, to help focus on this important initiative. Some have developed very extensive public education campaigns to get the word out about the importance of e-prescribing. Some have adopted regulatory changes, different approaches that we can all look at as models for our own states and see how we can make this more significant around the country. There are opportunities, I think, for making a real investment in e-prescribing by establishing programs within what we have now and leveraging other resources. So whether it's the use of ARA funds through the high-tech provision in that legislation or other types of initiatives, we've got to keep this agenda moving forward if we're going to make a difference for the American people. And as we will see in just a few minutes in the presentations that we'll make today, there's been quite a lot of growth in the states. So we're moving in the right direction. You saw that in Harry's graphs a few minutes ago. So the steps that we're taking are making a difference. But we've got to do more. We've got to exercise our leadership to ensure that we modernize healthcare generally, and in particular this aspect of delivering care to the people we serve. So again, Harry, thank you so much for your leadership, for the opportunity to be here today and working together. I hope we'll be back another year to celebrate even greater success. Thank you very, very much.
Thank you.
Thank you. It's now a privilege and honor to introduce my co-chair of the State Alliance for E-Health, the 48th governor of Tennessee. No, I haven't carried every county, even though I have fewer of them than Governor Phil Bredesen.